How do families cope with a brain death diagnosis? Imagine hearing that someone you love has experienced brain death, and you're trying to understand what that really means. It can be a confusing and emotional time for families. Brain death is defined as the irreversible loss of all brain functions, including the brainstem, which controls breathing and heartbeat. Even if the body still looks alive because of machines helping with breathing and circulation, the person is legally and medically considered dead. Families often see their loved ones connected to ventilators, which can make it hard to accept that they are gone. Support from medical professionals is key during this time. Doctors and nurses need to communicate clearly and compassionately, explaining what brain death means in simple words. They should repeat information if needed, because families may feel overwhelmed and unable to process everything at once. Using straightforward language and avoiding confusing terms like life support helps families understand the situation better. Building trust through honest and gentle conversations is very important. Families also need time to grieve and come to terms with the diagnosis. Rushing them or pushing for quick decisions can make things harder. Giving families space and opportunities to ask questions helps them process their feelings and find some peace. It's also helpful to involve religious or spiritual leaders if the family has specific beliefs. This respects their cultural values and can provide comfort during a difficult time. A team approach works best. When doctors, nurses, social workers, and chaplains work together, families get consistent support and information. This coordinated effort helps address emotional, spiritual, and practical needs. Sometimes, disagreements happen if families don't accept the diagnosis or refuse certain tests. In these cases, listening carefully, understanding their concerns, and involving ethics consultants can help find a respectful way forward. It's also best not to bring up organ donation too early. Families need time to understand brain death before discussing transplantation options. Offering families the chance to observe clinical tests, like the apnea test which confirms brain death by showing no spontaneous breathing, can help them see the reality more clearly. Overall, coping with a brain death diagnosis involves honest communication, patience, spiritual support, and teamwork. These steps help families navigate their grief and understand the medical facts, respecting their feelings and cultural values every step of the way.